one of the things I try to do is to put myself in the place of somebody in a bed. Whenever I go into a room, you know, whether it's my patient or somebody else's patient, and there's somebody in the other bed or in a wheelchair or a chair sitting there, I always say hello to them and ask them how they are. I always say to my nurses, you know, that would be terrible to be sitting there, you know, maybe you're aphasic and can't talk, and have somebody come in, see the patient, if it's a semi-private room or even, you know, out in the day area, and you're talking to somebody and you ignore, not willfully, but just don't say hi. It could be very lonely. It can be, and I don't think we address that part of going from living at home to barracks living. And sort of long-term care is going from living at home where you lock your own doors, you know, make your own meals, you toilet yourself, you able to go to the store, to all of a sudden in 5 days ending up someplace where there's something after the hospital, for instance, where you're acutely ill and you may or may not remember a whole lot of that. All of a sudden you're in a place where there are people up and down the halls, there's noise all the time, you may or may not have a roommate that makes things a lot different than what, you know, you may have thought the rest of your life was going to be. And I think that we really don't address this. We may call it depression, but we don't just say, you know, are you lonely? You know, I ask folks if they're sad, but I don't ask them if they're lonely. And just having this one little conversation might be something that I want to start to ask people. Do you feel lonely? Some people never have a visitor, or they may only come once a month. They may live out of state. And so I always try to include folks in everything that I do, because I think that if people feel wanted and they feel engaged and they feel like somebody cares about them, physically they'll do better.